Now, a lot of the EPCs that you do it is only at the patient's consent that we go through these, and often the patient gets their paperwork to go home and they have consented, signed a consent on it. Now, if I was in the practice, I wouldn't have gone to this step as yet. I would have looked at Fred to see where we're up to with his general health. If you go to current history here in Medical Director, it will drop down his current medications. If you go into progress notes, here, if you write a reason down on the bottom of your progress notes here, and you're seeing the patient today and you drop in a reason, then you know that the patient's come in for their diabetes assessment. You know that they've come in because they have got a sore ear, middle ear infection. You know they've come in for re-prescribing of medications. See here the reason for contact. So that makes it a lot easier. Come a scan of what the patient's had done, and that's quite an easy tool to use. So every time your patient comes in, you should be putting in the reason for contact. You can go into here and get your pathology results. Fred hasn't had any, but usually you would have that in chronological order, and you could scan from the oldest, which are at the top, the newest come in at the bottom. If they go and have their pathology done with Barrett and Smith, it's linked so that once the pathology arrives back at the practice, it will automatically come in and be able to be shown on the computer. If patients do use Central West and you have a physical sheet and you're on a computer practice, you literally have to go in and enter all those pathology results. So we'd get in, we'd have a look at the pathology results. Past history, again, we know this patient's had asthma, and it was the year of 1999. Before the patient even walks in the door, have a little bit of a scan around so you know what to expect when the patient walks in the door. You may be not asking the inappropriate questions like, have you ever had a heart attack? Where here you could be seeing that they've had coronary artery disease, they've had bypass surgery,